Let's talk about the topic for today. It's one of my favorite topics, vitamin K2. So today we're looking to clear up some of the confusion about vitamin K2. Does it take calcium out of the arteries, or does it impact insulin resistance, or maybe it's something else? It's interesting, out of all the K2 videos we've done, I have continued to want to cover one which talks about insulin resistance. I thought I had only seen one actual randomized clinical trial, but as you'll see today, there's maybe more out there which deal with the specific issue of K2 and insulin resistance. So vitamin K2, you see some buzz about it, but you don't see a whole lot of clarity regarding what's the real science, what's the real mechanism. You hear people say, well, you know what, it takes calcium out of arteries and puts them in the bone where they need to be. How would it do that? Well, there's a lot of interest, but not a lot of information out there. Let's go back and talk about that and talk about what it might be. And just a brief spoiler, it might be a little bit of both. So, 1935, there was a Danish biochemist named Carl Peter Henrik Dam. He described a food additive that reduced bleeding in chicks fed with extremely low-fat diet. He named it vitamin K. Why vitamin K? Because the German word, and he spoke German, for coagulation or clotting starts with a K, so he called it vitamin K. A few years later, an American biochemist, Edward Adalbert Doisy, determined that vitamin K's chemical structure and succeeded in synthesizing it. Dam and Doisy shared a 1943 Nobel Prize for their work on vitamin K. Now remember, this is vitamin K, not vitamin K2. And we're talking right now about that original vitamin K, which is integral to clotting or coagulation. That's actually phyloquinone, vitamin K1. For those of you who are biochemistry geeks, that's the molecular arrangement. As you start looking at vitamin K2, you begin to see that the minoquinones, the vitamin K1 is phyloquinone, vitamin K2 are the minoquinones, and there have been multiples described. The two that are most commonly known are minoquinone 4, or MK4, and minoquinone 7. Now, one of the things, again, if you get deeper into the biochemistry, you start seeing that the vitamin K2 variations have a lot more of these double bonds. That's about as far as I'm going to get into the biochemistry and the molecular structure. Now, vitamin K2 does affect bone growth, the loss and growth, the deposition and the taking back up of calcium. Simply adding calcium to your diet doesn't ensure bone growth. Other factors are involved, like hormones and vitamins. When talking about calcium absorption, we think first of vitamin D3, and it is critical to absorption. But K2 plays a factor. Now, again, we're talking right now about bones. We'll go back and we'll connect this whole thing about vitamin K2 and bones and calcium in just a few minutes, but be patient with us as we get there. K2 activates osteoblasts. Osteoblasts are cells which build up bone. For those of you who've been through physiology, you can remember blast has a B in it, and B stands for build. Osteoclasts has a C in it, and that means to cut away or to decrease. Osteoblasts are cells which build up bone. Osteoblasts produce osteocalcin. And osteocalcin is a protein or an enzyme with important roles in bone mineralization and calcium hemostasis. It's activated, it's very much involved in the activation. K2 is involved in the activation of osteoclasts and osteoblasts, and osteocalcin is a part of that process. And the process overall, what's called a carboxylation. Again, for you organic chemists out there, it's a carboxylation process, which, again, here's where vitamin K2 comes in. That carboxylation does not occur without vitamin K2. K2 inhibits osteoclasts, as we mentioned before. C cuts, so osteoclasts take calcium away from bone and inhibits those. Osteoclasts are cells which remodel bone by removing calcium. K2 also activates MGP. MGP is an acronym standing for matrix GLA protein. MGP is another protein which helps to ensure that calcium is used in bones and not deposited in arteries and other tissues. Now, scientists have noticed that vitamin K2 supplementation does improve prediabetes. Well, K2 takes calcium out of the arteries and puts it in the bone. Yeah, but there's another way, which to me, I wonder if it's not even more important. You may have heard the term pleiotropic mechanisms. Actually, I talked about that in one of my videos. Pleo means many, and trophic means to go to. Statins have pleiotropic mechanisms. They have multiple mechanisms. So not only do they decrease LDL, they also decrease inflammation in the artery wall. Well, vitamin K2 seems to have pleiotropic mechanisms as well. Not only does it impact calcium in the artery tissue and the bones, it appears to have something to do with insulin sensitivity. In 2010, Diabetes Care Journal, and here we've got a link here if you're watching this on a large screen. Here's the article, Dietary Phyloquinone and Minoquinone's Intake and Risk of Type 2 Diabetes. Dr. Jolene Boylans, she's a professor of lifestyle and cardiometabolic disease epidemiology at the Amsterdam Public Health Research Program. Her research is focused on nutrition, cardiovascular health, and prediabetes. She's been involved in several studies demonstrating that K2, or the minoquinones, have a preventive effect on prediabetes. This work on vitamin K2 prediabetes is still not completely proven, but there are meta-analyses already which support this. As I mentioned before at the beginning of this, I thought I had found maybe the only randomized clinical trial that mentioned this, and I found it buried one place in some really arcane literature. But as you go back and you look, there's actually even a meta-analysis. What is a meta-analysis? For those of you who don't know, it's looking at multiple pieces of research, multiple trials, and these trials looked at this specific question. So the title of that article is Effective Vitamin K2 on Type 2 Diabetes, a review. The study showed vitamin K2 intake reduced 7% the risk of type 2 diabetes with each 10 microgram increment. 7% doesn't really sound like a whole lot until you start looking at with each 10 microgram increment. So the question is, at least from the signals seen in this meta-analysis, significant, very significant, powerful impact. Vitamin K2 has a more significant impact than vitamin K1 on type 2 diabetes. And again, as I've mentioned from the very beginning, I felt like some of the original studies that talked about K1 and diabetes probably were confused over K1 versus K2. That remains to be seen. Vitamin K2 increased insulin sensitivity via osteocalcin metabolism. It improved insulin resistance via anti-inflammatory properties and lipid-lowering effects. Once you get a little bit deeper into the anti-inflammatory properties and the lipid-lowering effects, you might see, and we cover that in some other videos, some other blogs, you might begin to wonder, like I do, maybe it's not the lipid-lowering effects causing the improved insulin resistance. It's probably the other way around. The improved insulin sensitivity is causing improvements in lipids. Lipids, in case you don't know, pardon the technical term, cholesterol and triglycerides on a practical basis. You improve insulin sensitivity, you improve HDL, the quote good cholesterol, you improve LDL, the quote bad cholesterol, and you improve triglycerides. So that actually is a deep topic. I just finished a blog update on triglyceride over HDL ratio. That is a very, very interesting topic. I gave it to Chris last night. He'll be working on it, and hopefully we'll be putting it out and covering triglyceride over HDL ratio and the impact of triglycerides and the fact that HDL lipidology is very confusing, but there's some very important life-saving information in there. You want to boil it down, make it palatable, make it digestible. Enough on the triglyceride to HDL ratio. Again, this is where I went down that bunny trail. Improved insulin sensitivity, and we'll talk about that in that next video. Improved insulin sensitivity decreases triglycerides. When you decrease triglycerides, you increase HDL numbers. You increase the large fluffy HDLs, which are the ones that really help. And you actually move your LDLs back up in the proper direction, away from the small, dense, atherogenic SDLs up into the larger, fluffier LDLs, which do not cause plaque. So back to vitamin K2. It also suppresses inflammation, inactivating the alpha beta signaling pathway. Now, is that associated with insulin sensitivity? I don't know. That's a little bit deep for me. We were going to cover this video. It's a quick 1-minute video. It's been a very popular republication of a discussion on vitamin K2. But I thought, you know what? That's enough for me. Continue to get great feedback regarding the webinars. And here's why. You know, on the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, Inflammation Panel, OGTT, Insulin Survey Response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.